to introduce myself. I am Guinevere Burke. I am Director and co-founder of the Atlantic Fellows for Health Equity program. Have been with the program and designed it since its first program year back in 2017. We're excited now to be entering our 5th round of recruitment for 2021 and to share some information about the program and our recruitment season with you this morning. I apologize for the webinar format. I wish that I could see each of you and interact with you directly. Because of the level of interest in this year's session in particular, we did transition to this webinar format. And so I'll invite you, as questions arise during the presentation, please go ahead and type them into the Q&A function that you see. You can use the chat as well, but we're really going to be tracking using the Q&A. So I'll ask you to put your questions there. You don't need to save them to the end. We do have a chat and question monitor, Leanne Butler, who's with the program, and she will attempt to respond to your questions in real time, as well as raise some of those at the end for specific answers that are not addressed through the presentation. So once again, welcome everyone. We'll go ahead and get started, and please enter your questions as they arise using the Q&A function. All right, so let's get started. We have a half hour together, and I would like to use most of that time addressing your questions. We'll start with a brief program overview where I will present our program, our plan for the year, and introduce a few of our key faculty to you. And then I'll kick off the question and answer by addressing some of the most frequently asked questions that we receive, and then open it up for your questions. So briefly, an overview of the program. This is why we exist. We recognize that there are profound and life-limiting disparities in health and healthcare throughout the world. Imagine that that is why you are all here. And those disparities can be combated and mitigated. And this can really only be accomplished by people, determined people, just like the folks on this call, provided with the appropriate training and strategically located in health sectors around the world. The product of their work, their success, will be measured in years of life gained and quality of life enhanced for millions of individuals, families, and communities. And we are working toward a world in which the global community and its leaders strive to establish the conditions for all individuals and communities to achieve their full potential for health and well-being. And so this is our mission: to develop global leaders who understand the foundations of health inequity and have the knowledge, skills, and courage, importantly the courage, because this is not easy work, to build more equitable organizations and communities. We do this by bringing together people from all different countries, as are gathered here, different professional backgrounds, different cultural backgrounds. And the way we bring people together is by centering on these values: equity, clearly, inclusivity. We're looking for people who have an intellectual curiosity and really want to have a deep understanding of the problems of inequity in health, but who are just as motivated to take that information and put it into action, to really work towards finding solutions. We're looking for individuals who have the courage to take on this important challenge, who also exhibit humility in their work and embrace the diversity of our community, and who also exhibit creativity in their approaches. We need different approaches in order to realize change. Some very basic facts about the how we do this. We have a one-year fellowship program that is non-residential. It's offered at the George Washington University, and non-residential means that our fellows stay in their home, in their work, in their location, and visit with us periodically for our convenings and educational programming. The program dates for the coming year are June 2021 through April 2022. The program is open to early to mid-career leaders who are involved in work related to health. And this is deliberately broadly defined. When we first started, I think we imagined a few professions that would be important to the achievement of health equity, things like healthcare, obviously, but public health, law, journalism. In the time since that we've been operating, we have met individuals who have taken such creative approaches that we could never have imagined and never have defined that as an area that we were interested in working in and with different leaders. So this is pretty broad. If your work touches health and you're committed to health equity, I would encourage you to consider the fellowship. And we're recruiting 20 US and global fellows per year. So that's 10 from the US and 10 from other countries across the world. Briefly on our approach, what you see here is a blend of traditional classroom style learning. We try to make our sessions as participatory and engaging as possible. The fellowship was developed after years of experience in adult education, primarily in health policy at the George Washington University. And we blend those traditional classroom type settings with experiential learning. So we invite you to get out of the classroom, to walk with people who have experienced disparities, and also importantly, to walk and learn with leaders outside of the classroom who have really known success in addressing health equity. We also have a deliberate community building component to the program. So that's why I've pictured some of our fellows painting together. We take the time to paint, to cook, to learn, to laugh outside of the classroom, because again, we're bringing together a number of different diverse perspectives, and it's important for us to take time to value one another as human beings, to really take a deep understanding of one another's approaches and conceptualization of the different problems that we see and face. I'd also like to invite at this time some of our program faculty to comment on our approach. We have Sevle Freywat on the line, who is our Director of Online Learning for Health Equity. Sevle, would you like to introduce yourself and say a few words?
Sure. Good morning, good afternoon, good evening, everyone. We're so excited to see all of you today at this webinar. I am Sevle Freywat. I'm a medical doctor and health policy analyst, and I'm the Director of Online Learning for Health Equity for this program. I'm an Associate Professor of Health Equity and Global Health. So this program, as Professor Burke has said, it's a year-long program. Out of that year, 8 of those months are where you'll be engaging in an online learning. You'll be doing health equity online learning as well as leadership. And these are done every month. The first 4 months you'll be doing, then you'll get 2-month break, and then you'll be finishing in the end. What does it include? Health equities come in lots of prisms, from the time a child is born to the time a person becomes old and dies. So we try to cover as many things as possible during that: child health inequities, rural health inequities, health system and systemic inequities. We try to cover non-communicable disease, infectious disease inequities. We try to do all these things as we are going to focus not only on US-based health equity issues, but most importantly, globally, those that address also low income as well as middle income countries. We engage many leaders around the globe, not just because they are leaders, but these are people who have actually made a difference on the ground. We bring them via Zoom, and we'll be discussing in the classroom, which the classroom usually takes an hour and a half every month. I will now give the segue to my other colleague who arranges and teaches the leadership component. Kate Hilton.
Hello, everyone. Can you see and hear me? Hello, can you see and hear me? Oh, great. Okay. Great to be with you. My name is Kate Hilton. I am faculty at the Institute for Healthcare Improvement and leadership faculty in the Atlantic Fellows Fellowship. In this program, we'll be teaching leadership from the world of community organizing, from social movements and social action. And we take this approach because organizing itself is a complex social science. It draws on multiple methods. Fundamentally, these methods are a set of leadership practices designed to enable a community of diverse actors to be transformed into a collective of people who stand together to mobilize towards a common cause, and in our case, the cause of health equity. So here's what the leadership approach is not in the program. We are not taking an approach about being a political marketer who's selling a cause by appealing to the preferences of customers. We are not about being philanthropic providers who are offering services on behalf of or for other people. We are not about being social entrepreneurs who devise technical solutions to challenging public problems. And it's not about being a top-down boss or manager who embraces more of a diva model of leadership. This is about starting with people with lived experience of a problem who can identify how they experience that problem and how they'd like to solve that problem in order to keep it solved. And it's about building new power to affect change. So the first question that we're asking in this approach to leadership isn't what's the problem, it's who are your people? Who are your people? And the idea here is that as leaders for health equity, we recognize that people are at the center of everything we do and that they are our greatest asset to affect change. And so we're going to be building power from our people. That could be power with, so building, and collaborating in new ways that might achieve something that hasn't been done before, or that no one of us could achieve alone. And we might also be addressing a power over situation where we're challenging a policy or a decision that's a barrier to the change we seek, or we might be doing both. And this model is not a compliance model, like do as I say, or here's the mandate, or here's the protocol. This is a commitment model. This is a want to approach, not a have to approach to leadership. And that means leadership here is a set of practices, not a position. So your authority is earned and it's not bestowed on you based on your positional authority. Of course, you may bring many assets to your leadership in the program. I would just note pedagogically that we take very much an experiential approach to leadership. You will be asked to have a health equity project with real outcomes, working with real people during the course of the fellowship year. And through that project and through other work that you take forward, you'll be asked to put into practice a set of leadership methods that you'll be experimenting with, and you'll be learning what it feels like. This is so that we're taking a very head, heart, hands approach. The first question is how you can use your assets or work with people in new ways to achieve your goals. This is a challenge to your head or your strategy. We'll also be focusing on your courage or your hopefulness or your forbearance or resilience to respond purposefully. And this is a challenge to your heart or your motivation. And then last, the skills that you need to deal with new challenges, which is a challenge to our hands or really a set of leadership practices. So we look forward to learning more about you and the projects you envision. And if you're interested in the practice of leadership instead of the study of it, then this fellowship is for you. And with that, I'll turn it back to you, Gwen.
Thank you, Kate. Thank you so much for that. And just one point of clarification, I appreciate the comments that you've made. Social entrepreneurs are absolutely welcome in the program. I think the distinction that Kate was making is about an emphasis on technical approaches, which is not our focus. So thank you for that. All right, so just briefly, I'd like to make sure that we get to questions, but it is important to touch on senior fellows. This is the term that we use for our program graduates. And this is important because we don't call our graduates alumni. This is not an alumni network. This is not a passive experience. Health equity is not achieved in 1 year. It's not achieved even in 2 years. And so we fortunately have funding to operate for a number of years into the future. And we're looking for people who are really dedicated to engaging with this program and with this community of leaders for a longer period of time. People who want to continue to learn, who want to continue to grow, And as Kate mentioned, to take responsibility for others doing the same as well. So people who are going to be actively engaged in this community, working towards health equity across the world. We have Jamar Slocum, who's a newer member of our faculty, who is currently leading our Senior Fellows educational content and curriculum. Jamar, would you like to say a word and introduce yourself?
Hey, good morning, everyone. How's everyone doing? My name is Jamar Slocum, as Dr. Burst stated, and I am the Senior Fellow Instructor for AFI. I am internal medicine / preventive medicine trained, and here at the fellowship, we really understand the challenges and oppositions that come with being a health equity champion and advocate. And we know it is hardly attainable to provide you with all the details and elements that is needed to support you in your journey. So it is my job and our job is to provide you with that continuous learning environment that once you complete the fellowship, that we'll be able to provide you with things like mentorship and webinars, workshops, open forums on various topics from leaders domestically and globally that can help and support you along your journey. So therefore, Dr. Burt Salam and others, we're very excited about this upcoming year because we understand that when you guys are successful, we are successful, but most importantly, your institutions and your communities are successful. So we're going to do as much as we can to provide you with things and meet you at your needs. And we're excited about having you all have the possibility of joining us. Thanks.
Thank you, Jamar. So I will present this comment because as usual, our fellows really say it best. This was from Mary Ashwang, one of our first fellows in the 2017 program year, who noted that the work is never finished and it can and will break you down. But when you have the opportunity to stand by, grow, and learn from other health equity warriors such as these, the mindset becomes what next? Because what got you here won't get you there. And this is an acknowledgement of what we see in fellows who are interested in the program. They're looking for that next step of training and community and fellowship. One final note before questions regarding the Atlantic Institute. We are one of 7 global Atlantic Fellows programs. The other programs focus on health as well as racial, social, and economic equity. We are all joined together by one entity in Oxford called the Atlantic Institute, which has a close relationship with the Rhodes Trust and the Rhodes Scholarship, and exists to continue to provide community for our fellows. Our community right now with the other 7 programs is at about 500. It's projected to grow to a few thousand. And the Atlantic Institute is able to offer opportunities for convening, collaboration, and funding for ongoing work of our senior fellow. So to questions. This was one of the most important questions this year, of course, COVID. And the question of how it will ultimately impact the program still remains a question, to be very brief and to be very frank. We hope to convene in person. As I mentioned, community building is a really important part of the program. So important that we deferred our program year from its usual start in January to a June start in an effort and in a hope that we would be able to gather in person. I can tell you that the George Washington University made a decision just a couple weeks ago that we will not be gathering in person through May of 2021. So where we will stand in June still remains undetermined. If we are not able to gather in person, then the convening dates you see will be transitioned to virtual convenings. This is the application timeline, which I hope you're familiar with. Applications are due November 20th. We'll look to make our final selection in mid-March. And as our applicants proceed through the selection process, we will provide you with updates on the impact of COVID in particular and what to anticipate in terms of the program year. These are some of the most common questions that we receive about letters of recommendation and letters of support. As noted in the application, please have someone complete the letter of recommendation who is familiar with your work. A professional relationship is probably the best and most appropriate person for this letter. Someone who's very familiar with your work, your accomplishments, your drive, and can speak to those. We do ask that one person is from within your organization, ideally in a supervisory role. But please note that the letter of support is distinct, and we should probably rename it because it's less a letter and more a form. The letter of support is automatically sent to the person that you designate in your application after you hit submit. And we ask that you identify and send this letter or this form to someone who is your direct supervisor, because what we're asking for in the letter of support is really just an expression that you will be free to participate in the fellowship activities, that you will be granted time to participate in convening, to participate in online learning, and that in participating in the fellowship, we won't be taking you away from your other commitments, but that you will be given express permission and hopefully encouragement and support to pursue the fellowship activities. And this is based on, again, our years of experience in this area and really recognizing that that's what it takes in order for you to realize success. Can students participate in the program is another common question we receive. The short answer is yes. However, as Kate Hilton noted, our approach is really hands-on. We want these lessons to be applied lessons, not theoretical lessons. And so we've had students participate in the program in the past. Those students were also working full-time so that they had an area that they could apply the lessons of the leadership program, where they could reflect on the practices of leadership that they had used and use those experiences to grow further. So the short answer is yes, but you need to have some area of active work and engagement with health equity so that you can really dive into the curriculum. And what is the time commitment? We have a time commitment of 4 convenings traditionally in person. They may, as I mentioned, transition to virtual. But if we do convene in person, it's a total of about 5 weeks of in-person time, and that's all day, every day when we're on the ground. If we're virtual, it will be less than that. And we meet twice monthly online for online learning sessions when we're not convening in person. And then there's otherwise self-directed learning. That's about 12 to 16 hours per month. So I hope that gives you a better sense of some of the really common questions. And I have noticed numbers soaring in the chat and in the Q&A, so I'm sure there are additional questions out there. And I will go ahead and stop the presentation, of course, noting that you can always find more information at our website. And you can also email us with additional questions after the session at afhe@atlanticfellows.org. This presentation will be recorded and posted for your reference as well after we wrap up. So thank you. I will stop this presentation and address any remaining questions along with the other faculty who are here.
Dr. Burke, it's Leanne. There are a number of questions coming in about the project proposal. Can you speak a little bit on that and if there are samples that are available?
Yes, so that's a great question. We have not provided samples in the past. I think I would hesitate to do so for the same reason, as I mentioned, we don't specify specific occupations or professions that are best suited to the fellowship. We really want you to be creative and to imagine health equity in ways that that haven't been done before, and approaches that haven't been necessarily tried or tested. It's difficult and challenging, I understand, because we're asking for something that can realistically be accomplished in a year, but at the same time, we want you to be ambitious and we want you to stretch. So we will not be providing specific examples, but keep in mind the outline that I just provided. So we do ask that it's something realistic for the fellowship year, but do challenge yourself to stretch a bit and think, you know, not necessarily in a perfect world, or in a perfect world. Your hopeful vision is what we ask for. So take a moment to hope, to dream, to imagine. And we understand that, you know, when you do come to the fellowship, it will be months later. It will be some time since you created that initial proposal. And we understand that a part of kicking off the fellowship will be, you know, taking that plan, potentially totally scrapping it and putting it back together again. And if you don't do that when you start the program, then I will think we probably haven't done our job, because you won't have learned a new perspective, a new approach to health equity work. So take a moment to dream, to be ambitious, to put those thoughts on paper, and to really challenge yourself to have measurable outcomes associated with that. And just know that we will work with you to revise those plans when you join the fellowship.
And Gwen, if I might just add, it's really also key. We're looking for projects that not only have clear, concrete action that can be achieved during and that might build towards what you're doing after the fellowship year, but there's real people involved, that we're taking an approach to leadership that's about taking responsibility to enable other people and communities of people to stand together to achieve that purpose. Which means an approach to leadership where you're developing not only your own leadership, the leadership of others to build their capacity to create new power to achieve those aims. So we will be looking to see that there are real people engaged in the work. It's not sort of something that you do in the back office by yourself or so on, but that there are people supporting that.
Those are really important points. Thank you, Kate. Leanne, what other questions do we have?
So we have a number of questions that are about the letter of support. If you are kind of the lead within your organization, who can write that? And if you have 2 supervisors, do you need 2 of them? A lot of questions kind of around that letter of support.
Sure. Okay, so you only need 1. So if you have multiple supervisors, only 1 person needs to complete it. And if you are the lead within your organization, this often comes up as well. Thank you for that. There's often a board or supervisors or other close colleagues with whom you work. And so I would ask you to forward it to them. Even if you're the leader of your organization, you must have accountability, we would hope, to your community or to someone else. Send it to that person to whom you have accountability for your time, because that's what we're asking, that you will have the time, effort, and freedom to participate in the program.
Another question is, what is the timeline for a final decision on fellowship awardees?
Okay, so I put that information up in the presentation. I can attempt to go back to it, but it's also posted on our website. So we anticipate sending final notifications in March. We will, of course, be doing interviews in the interim. So this year, for the first time, we're going to be doing 2 rounds of interviews. And so you should be hearing from us sometime in January with the initial notification about selection for interview. And those first interviews will be video interviews. So those will be on your own time, making sure that you have the ability to test your audio, test your video, test your internet connection, because that often we recognize can be problematic in different areas. And so we have first round interviews, and then we'll have second round interviews where you're able to speak with our staff and with our senior fellows who participate in the selection process and present yourself. And so our final determinations, as noted, will be in mid-March. And as we go through the process, we'll provide additional updates on any anticipated changes to the program as a result of COVID.
There's a question about, is there an opportunity in the program to hone or learn data analysis, such as mediation and social network analysis?
All right, so we do not have a specific emphasis on data analysis. As Kate mentioned, the emphasis is more on working with others to achieve change. And so while understanding data, using data, interpreting data are all incredibly important to health equity work, this is not a program that's really for researchers per se who are not engaging with communities, with others to implement the findings of their research or to take their research into action and into the field. That's the level that we're operating. So we do not really go in depth in data analysis and some of the other skills that you've mentioned.
Is there, given the interest in global health equity, is there a preference for the U.S. applicants to have global health equity work experience over local?
No, that's a great question, interesting one. The original concept of having 10 fellows from the US and 10 from across the world was that we need leaders in the US who are more outward facing, who are willing and ready to learn from other countries, from the global South, and look for creative solutions to the problems that are stubborn within our borders. But it doesn't necessarily mean that the US-based leaders need to be working already globally. We're looking for people who are willing and ready to learn from others in other countries and contexts, not necessarily folks who are already engaged in global health, but based in the United States.
And if I can add on that, we really do believe in north-south learning, but south-to-north learning also. We believe knowledge and wisdom exist everywhere, and that we should be wide enough, have a wide mentality, and humble enough to be able to glean wisdoms and knowledge from wherever it comes.
Another
Well
question.
said. Thank you, Sandra.
Another question is, can we accommodate participants with physical disabilities?
Yes, we can. And thank you for that. We took on that challenge for the first time this past year in our 2020 program year. And I'd like to say that I think we're actually very successful with it. So we were limited this year by our ability to gather once the coronavirus struck, but we had our first fellow that required accommodation, and we did everything that we could to meet her accommodation needs. And we're happy to do that going forward. And if we're not bringing people with disabilities into our community, then we're not living our values of health equity. And I think perhaps, Dudley, I don't know if you want to say anything else on that as well.
Yes, we strive. Our motto is walk the talk. Okay, so we cannot say equity and not talk, walk the walk. So yes, we strive in every way possible to make anyone that has any kind of disability feels welcome, challenged, and as much as we can take care of things when it comes to the curriculum, how it is delivered and all. So yes, please do apply.
And I understand we're over time. I am able to stay on the line if there are a number of additional questions. I understand and recognize that others may need to log off, but I am available for additional questions if they're out there. And again, we'll post this for anyone who does need to sign off at this time. Do we have additional questions, Leanne?
Yeah, so there are a number of additional questions. One is, do you have a course syllabus available so we can get a sense of the topics discussed during the year?
Yes, of course we do. We do have a syllabus. It is, I'll tell you, continually under development as we're refining each and every year. That said, it's an excellent suggestion in terms of kind of posting the topics so that you can get a better sense, and I'm happy to do that. And if you email us, we can send you additional details. So please email that afhe@atlanticfellows.org, and I'll also work with our web team to get something posted. Thank you for that question.
Gwen, I'm happy to speak just to the leadership content, and maybe Sibley could to the health equity, just to give you a flavor. So in the leadership, you'll learn about organizing as a theory of change. You'll conduct root cause analyses. You'll think like a systems thinker. You'll be crafting compelling public narratives. You'll make calls to action. You'll be mapping your stakeholders, your assets. You'll be employing relational strategies. You'll be creating conditions for effective teams to work together, establishing leadership structures that are distributed and interdependent. You'll be engaging in participative management practices. You'll learn about coaching skills. You'll be making clear and compelling asks of others. So, I mean, I could go on and on, but that gives you a feeling, and those are very practical and tangible methods that will, again, invite you to put into play in your work. And Sibley, would you like to add?
Yes, so the curriculum, as I said before, to start with child when health inequity and end with elderly health inequity, but within the component breakdowns, this is e-andragogy, it's not e-pedagogy. So you will be the teachers also. So in every session, based on the topic that will be discussed, let's say the topic that will be discussed is rural health inequity, in the beginning of your session during initial convening, you'll be signing up to those 8 sessions, which one you want to bring your mind, your focus, your interest to, and you'll be presenting during those classes. The experts that will come will first give the lecture or the talk. But before we do even that, you have to get engaged with the required readings as well as the required video that we're supposed to watch, and then required discussions. So the class starts even before the synchronous session is due, so that we can have in-depth discussions. These are the questions that we're going to answer are not something that there's answer out there just readily. So we really have to dig deep how to work in an interdisciplinary manner with interdisciplinary professions. That's why, as Professor Burke has said before, we really are looking people that come from any and every field out there, but who have the passion of health equity, so that they can bring vital, important discussions to our classes. So it is multifaceted curriculum. So we call it as a hybrid online class.
Thank you. If I may, Leanne, I see I'm able to open some of the questions now and take a look at them. I do want to address one that's about financial support, because this is something that really commonly comes up as well. So Patricia asked if there's financial support provided to fellows for their projects. The short answer is no, there is not. We provide financial coverage for all costs related to participation in the fellowship itself, but we do not provide additional stipends or support for the project. That said, once fellows graduate and become senior fellows, there are grant opportunities available from the Atlantic Institute. Those are specifically targeted to support projects that are collaborations between our fellows in the GW program and other Atlantic Fellows programs across the world. So financial support for participation in the program during the fellowship year, and additional funding opportunities after graduation as a senior fellow, provided that projects are a collaboration with other senior fellows.
A number of questions have come in asking if the employer support letter and the references and recommendations can be the same person.
Absolutely, they can absolutely be the same person, yes.
And one question came in asking that, saying that candidates are welcome from low to middle income countries, and asking what about high income countries, as there are obviously health inequity problems around there too.
Yes, thank you. And I thought we had updated this language. My apologies. Last year, for the first time, we opened applications to people from high-income countries outside of the U.S. You're absolutely right. There are disparities in high-income countries like the U.S. and many others. I'm not aware of a single country that does not have them, unfortunately. So those applications are welcomed, and we will review them. Our traditional focus was on low and middle income countries, but over the years, we saw a number of folks who were really impressive and doing great work, and seemed that they would be excellent mentors and peers to our other program participants. And so we're happy to consider applications from high income countries as well.
There's a question asking if there's support in terms of the request for a visa for traveling.
Sorry, say that one more time, Ian.
Is there any support in terms of the request for a visa for traveling? Yes,
of course. So we will provide letters for those who require a letter outlining their reasons for travel, details of the fellowship. We don't provide kind of in-depth legal support or other for people who require additional kind of engagement in order to obtain the visa. So we provide letters. We're happy to support with the necessary documentation, but just to be clear, we can't provide additional legal counsel or intensive support for those who are looking to obtain visas.
And will the curriculum content overview be available beforehand?
Before the application deadline? Yes, we can get that up before the application deadline, absolutely.
And it was answered in the Q&A chat, but some people were asking about the number of applications that we normally get, and if there's any limit, like they know that you said 20, but if there's a hard limit on that.
Unfortunately, there is a hard limit on that. So we're even pressed at the 20 fellows per year, and that's primarily because of the community building aspect that I mentioned earlier in the presentation. So it's tough to foster a sense of community and allow people opportunities to really take a deep dive in getting to know one another once the group gets beyond a certain size. And so in our first program year, we had just 15 fellows. In subsequent years, we've had as much as 21 last year, and there's a big difference. So we are not willing to go above 20, unfortunately, and it's so challenging and so humbling every year to hear the excellent and impressive work that is happening all over in the health equity space, and it's challenging to select just 20 fellows, but we still must select just 20 fellows.
And do we have an age limit for applicants, or what do you mean by early to mid-career?
That's a good question, and it challenges us as well each year. There is not a specific age limit. We have had some folks who are a bit older and taken them on the basis that they're actually mid-career and sometimes their second career. But if you're basically kind of looking forward to retirement in the next few years, we would, say that you're probably not the proper applicant for the fellowship. We're really looking for people who are just getting started so that we have the opportunity to provide you with skills that you'll be able to put into use for many years to come. But that said, there are some folks who are slightly more advanced, who again are excellent peer mentors and additions to our community, and we don't want to lose the richness of their experience. So that's why we don't put a specific age cutoff, and we look to each individual application.
There are a couple of additional specific questions about the employer support letter. What if the employer you have to get support from is not necessarily the one that's most suited to serve as the advisor and assister?
That's okay. As I mentioned, the employer support, it's not so much a letter as it is a form. So if the person who is able to make decisions about, your hours and your leave, et cetera, if that person is willing to commit to giving you time to participate in the program, even if they're not necessarily going to be your most enthusiastic supporter, and thankfully you have other enthusiastic supporters, still send it to the person who allows you time off to participate in other activities, because that's what will be required to participate fully in the fellowship.
And that's all of the questions from the Q&A.
All right, amazing. Well, thank you everyone for joining us. We went far over our time, but I appreciate all of you and your expression of interest in the program. This has been a record level of interest that we've seen this year, and so we're looking forward to a strong recruitment season and looking forward to learning about the work that each and every one of you do across the world. And thank you to our faculty and staff for supporting this program and for lending your expertise to the fellowship and to this session. Thank you, and we'll look forward to reconnecting soon. Bye.